It's very true. Like a lot of times, give you an example. Like a lot of times, patients come and they have a grossly bombed out tooth for many months or years. Okay, suddenly he comes and says, "I want to have it extracted, and I want an immediate implant in an upper first molar or whichever tooth." I'll tell them, and there is an infection, periapical radiolucency and stuff. So I tell them that I would recommend that we first do the extraction, clean up your socket, and see, and then do. Why I do that? Because there's no Dr. X said that no, he will extract and put. I said yes. If he is confident, I would suggest that you return back to that dentist. Why did you come to see me? They came to see you because they were not 100% satisfied. And I am very picky and in all my cases, whatever I do. So if I find that a tooth is not restorable, I will not advise the patient to get it root canal treated. Because when you do the root canal, they've spent so much money and you cannot crown the tooth or restore the tooth.
Then what's the point?
What's the point? So this is why I have a high success rate because I pick and choose my cases. Similarly for implants, I will not put an implant if there's an infected socket or not. So I have a high success rate. I play it safe because these are all expensive procedures. In our country, we don't have insurance. So the patients are all paying from their pocket.
Yeah.
So after spending much cost for the root canal, for the crown, for the prosthesis, then you tell them that now this has failed after 2 months or 3 months, or it cannot be restored. It's not very fair for the patient.
Absolutely, and this is a very important point that you have addressed, that we keep on talking about how patient needs to do this, patient needs to do that, but it is equally important to understand that the way we are going to be fair or unfair to the patient is what is going to lead to the success of the procedure, and also it's going to lead to whether or not they trust us enough to come back next time or refer us to somebody else. So one of the practices of dentists, coming back to managing pain via drugs, one of the practices of dentists unfortunately is that even though antibiotics, like you said, can be useful in some areas and under some conditions, but it has become a routine practice for dentists to just prescribe antibiotics like candy. एंड एक तो वो वाला पार्ट है ना कि पेशेंट्स बगैर पूछे खुद हकीम बन के जो है वो ले आएंगे एक एजिथ्रोमाइसिन का पत्ता और खा लेंगे उसको पूरा का पूरा. बट और फिर कभी कभी ऐसे खतरनाक बातें कर रहे होते हैं आके, मैं 2 महीने से खा रहा हूँ. लाइक क्या खा रहे हैं 2 महीने से एजिथ्रोमाइसिन? लाइक oh God, I want to bang my head on a wall. But then doctors also do this sometimes. Okay, for every after every routine procedure, they are going to write an antibiotic just in case. How would you comment on that?
No, because you see, again, you have to know the kind of procedure for which you are recommending. Some patients, some procedures, you don't need an antibiotic. Just a good analgesic, a good anti-inflammatory will take care of the problem.
Right.
So, but if you feel that there is an infection or and the patient
something severe,
then only you prescribe, and you have to explain to the patient. And I'm glad now at least there are areas now when you go to the pharmacies, they are bringing in that you cannot just walk ahead and go and take a prescription. Many pharmacies have said, Doctor Sahab, aap hame prescription bhej dein.
Okay.
And so because here, people living in the West, they'll say when you're coming, aap hamare liye augmentin le aaye, ye le aaye, wo le aaye. Now there are the Sindh, I think, commission is being
the drug regulatory authority.
Yeah.
Yes, definitely. वो जो over the counter medicines हैं वो रिवाइज होती रहती हैं और बिल्कुल होनी भी चाहिए. I think over the counter medicines की तादाद जितनी थोड़ी कम होती रहे उतनी ही बेहतर है. Because why? लेकिन पता है डॉक्टर ने इससे एक मसला थोड़ा सा exaggerate भी होता है. वो मसला ये है कि जैसे आपने mention किया कि a lot of people are not able to afford dental procedures because dentistry is an expensive commodity field. Absolutely, commodity.